and welcome to February at the Minnesota Association for Children's Mental Health. My name is Hannah Coyle, Communications Specialist here, and it is Black History Month. As a children's mental health organization, our mission is simple. We are here to promote and pursue optimal mental health from infancy to young adulthood. This month, we look at the impacts that generational trauma and inequality have on the young Black people in our communities, and how we can best support and encourage them to prioritize their mental well-being. We are joined today by the Minnesota Association for Children's Mental Health Executive Director, Brandon Jones. He has a rich and knowledgeable history of working with young people to aid in building positive mental health outcomes, especially with Black and African American youth. So I will let Brandon introduce himself and a little bit about his work.
Great. Well, thank you. That's amazing. It's good to be on this platform and to share for Black History Month. My name, again, is Brandon Jones. I am the Executive Director here at MacMA. My work with African American youth stems from really doing youth work. I did a lot of youth work, working with younger kids, but from a mental health standpoint, I really kind of dug my feet in the sand back in 2009 when I left the psych department and became a case manager at Booth Brown House, which is a Salvation Army program for transitional age youth. And being a case manager, one of the things I noticed is that a lot of young people that I was working with who were kids of color had left home because they had some tough family dynamics, and those family dynamics involved trauma. And that's what kind of started off my trauma career. During that time, I was in the middle of my first master's degree, which was in community psychology, and I realized that if I wanted to help these young people from a deeper kind of lens or perspective, then I would need to go back to school and get a master's in psychotherapy, which I did, and became a therapist. And I continued to do that work as a case manager until it was time for me to leave the case management field and go into doing therapy. And for the most part, I would say my therapeutic career, most of my clients were adolescents, and it was kind of like adolescents and couples were kind of like my two go-tos. So I'd spent a lot of time working with young people. I did school-based mental health therapy, school-linked. I've done private practice. I've done work with a community organization, and I've worked for a health department from a therapeutic standpoint as well during my career as a therapist. But all my work really has been around helping young people.
PTSS results from that multi-generational oppression and the enslavement of Africans and their descendants. Many folks understand PTSD, or post-traumatic stress disorder, where a person has a difficulty recovering after experiencing or witnessing a traumatic event. Post-traumatic slave syndrome, or PTSS, adds specificity and a generational lens to trauma inflicted on an entire group of people. Brandon, as someone who has spent a significant amount of his professional career working with young Black children to teach and build optimal mental health, how do you understand the impact of post-traumatic slave syndrome on young people?
Yeah, great question. And shout out to Dr. Joy DeGrew. I've done a lot of work. Well, she's been a huge inspiration for me doing this work. She's one of the people that encouraged me to go into therapy, but I've actually worked with her daughter more closely on some similar projects focusing on historical trauma in African-American families. And her daughter followed her mom's footsteps, so they do great work. And really, for me, I think the way that historical trauma impacts is two ways. One is through epigenetics, and one is through what's called transmissions theory, which is just culture and behavior. The cultures now, I would say there's some subcultures, but the main overall African-American culture, from my perspective, and some people may disagree with this, has been in response to white supremacy and being, quote unquote, oppressed. And what I mean by that is African-American folks who have slavery in their history have built culture around being in oppressive environments. So from the languages we speak to how we name our kids, the clothes that we eat, or the clothes that we wear, the foods that we eat, the religions that we subscribe to, excuse me, all those things have been in response to being in a white system and rebelling against that system. And we've developed culture around that over years. Now, some of the habits and patterns of that culture might not necessarily match what they used to at the time, which is where the transmissions theory comes from, where people do, specific type of behaviors at one point in time for survival, and then they pass it on to the one generation that passes it on to the next. They might not need that anymore. Like, we're not under the same level of oppression that we were back in 1809. Like, this is not the same place and same thing. However, there are some people who respond like we are. And I think that that's also part of that conditioning piece, is the mentality and the understanding and the context of what's going on for some people. leaves them in a victim state and not necessarily in a victorious state, and seeing the resiliency and the overcoming that many African American folks have been able to do in this country. The other thing is epigenetics, which is becoming more of a popular term, but it's the stress hormones and the genetic factors that are also passed down, genetically from generation to generation, that I think does have a lingering impact and effect on how people develop in spaces. So we have those things that play a role in the development of people today. And most people don't even know this. Most African American folks have no idea. I know when I came across this information, it connected dots for me, but I was just like, wow, I didn't know that this trauma thing was a thing. I just thought that Black folks were defective and we had to get our stuff together. And that was just kind of my thought process and me just trying to figure it out. But there were some answers to why we are in this position. But I also think that that's not the end of the story, and that's not the kind of exclamation point. I think that that's a awareness piece, and we should use that to continue to develop further, and not just say, see, this is why we are the way we are, and we can't get any better is because of historical trauma or post-traumatic slave syndrome.
So when it comes to treating and working with youth who are experiencing or have experienced trauma, as a mental health organization, we work with providers and the professionals doing the work with children. According to the Minnesota Department of Health, approximately 79% of Minnesota's statewide population is white, 88% of its mental health workforce is white. So roughly 7% of Minnesotans are Black or African American, yet less than 2% of the mental health workforce is Black. This is sort of a twofold question, but let's start with who we have in the workforce right now. As a sweeping majority of the available professionals are white, how can we ensure that they are equipped to provide safe and informed anti-racist care to the young Black clients?
Yeah, I think this is where our DEIB trainings are very important. But even more important, I think, is examining white culture. A lot of white Minnesotans don't believe they have culture. But if you compare white Minnesota culture to white, Boston culture or white Louisiana culture, they're different. There's different, unique things about them. And I think it's important for white folks to, one, understand that you do have cultural elements. You're not cultureless or anything like that. And when we talk and we use terms like that, it really continues this narrative of othering. And I think that one of the tools that we can use is something called cultural intelligence, which is just identifying there are differences within culture, but also how do we function within these differences is a big piece of the work. I know anti-racism is a huge focus for a lot of people. I think that that's important as well, but really understanding culture, I think, is the key. We are never going to close this gap on mental health providers and of color. This is not going to happen. Just by numbers, it's not going to happen. I don't know African American folks who are beating down the door to get a master's degree in counseling, so it's not going to happen. So we need white providers to be more inclusive for everybody. That's for LGBTQIA plus folks. That's for folks who speak multiple different languages that are not English. That's for folks who have different neurodivergent statuses. We need white clinicians to get out of this kind of standard understanding of how a client is supposed to be, and understand that people are coming with all different types of things, and we need to be open culturally better. And when it comes to Black folks, I think, or Black clients, understanding that there is a historical relationship to the medical system. There's a historical relationship to systems in general, like county systems, where there's some suspicion and some discomfort that comes with being a client, but being able to articulate how your therapy or your practice will not contribute to furthering that suspicion or that harm that is perceived to happen. Once people get that, I think that you can make some beautiful therapeutic relationships with folks. I've seen it happen. And I think another key piece to this is to be authentic, being yourself, and understanding if you're a 45-year-old white woman from Chaska, Minnesota, you can work with a Black client. If you're just who you are, if you're being authentic, you can build that relationship. Because at the end of the day, we're not talking about things that are different from folks due to culture. We're talking about mental health. Like depression may operate different in different people, but your treatment should, your treatment should still be somewhat on the same level, no matter who comes to your door, because you've been trained with those skill sets to deal with that. but also keeping in mind the cultural context and utilizing that when you need it, but not saying I can't treat this person because I don't know their cultural background. I know when I was going to school, I never thought, oh, if I get a Hmong client, I'm not gonna be able to serve this person. It was just like I'm just gonna learn about them and go as far as I can with them as best as I can, and do just good therapeutic work.
So in terms of the care network that we do have, how do we create a system where we are supporting and avoiding the burnout that might come for Black care providers?
Oh, burnout for Black care providers. Honestly, I wouldn't even separate it between Black care providers and other providers. I think that this field is so emotionally taxing, period, that people have to just take care of themselves. And the way that I'm going to get in trouble for saying this, but you don't have to edit that part. I was going to say it anyway. But the way that mental health, the business, is shaping up, it is pushing people out of this field. It is wearing people out. I mean, people are being asked to see like 30 clients a week. That is way too much. And if you're already dealing with stressors due to culture or maybe the neighborhood you live in or social economic status, because a lot of mental health professionals don't get paid the greatest, you will leave. You will go work at Target. You will go work for Amazon. You will go drive and do DoorDash and have like 5 different jobs because it's too stressful. And people are looking for work that's not overly taxing. And when you have to listen to someone who was sexually assaulted and to someone who's gone through domestic violence or someone who's gone through trauma or someone who's chronically depressed and doesn't see any way out, and that's like just the first 5 clients of your day, by the time you clock out and then you have to go home to your own family, that is a lot to deal with. So we have to rethink how we're doing this business of mental health to give our providers a chance to even do quality work. I tell you right now, the reason why I don't practice clinically is because I got burnt out. I was a black male therapist. I didn't have the greatest supervision, even though I loved my supervisor at the time. She wasn't the best because she didn't understand the cultural things that I was sharing with her. And I didn't have like mentors. I just didn't. I just was just a black dude with his cape on trying to save the community, and that's not a good approach. And I got burnt out very quick. And I remember I used to hate going home, used to hate going to work. I'd sit in my Jeep and just be like, man, I don't know if I like mental health at all. And it got to a point where I had to make a career shift, still in the therapeutic space and mental health space, but I know that if I didn't make that shift, I don't know where I would literally probably go work at Target, like no joke, because it was just too much overwhelmingness for myself.
So from a perspective looking at the work that MacMA does, are there specific things that we are looking towards and working on that will kind of bridge this gap or support those?
There actually is. Yeah, some of this isn't public because we're like in the developmental stages, but we are working with Adler Graduate School on a few different projects to help not only help professionals of color, black professionals included, come into the mental health workspace, but also the folks who are already here to help maintain them. Because quiet as it's kept, a lot of black folks go, not a lot, but there's a significant amount of black people who go and get counseling degrees, but once they are done with their degree, they graduate, they don't go into the counseling field. They go find other types of jobs. And I think one of the reasons for that is it is overwhelming. It's taxing. There's just so many different challenges that happen, as I was speaking to before, that something needs to be done. So, I've had several people come to me and say, hey, how can we kind of curve this thing? You're someone who left the field, but you're still here. Like, can you help us kind of answer these questions? And I said yes. So we're working with Adler Graduate School. We've also are working on a project called the Cultural Providers Network that used to be with the University of Minnesota to help with some maintaining of professionals of color and helping them share their perspective. So we have some smaller projects that are on the way, but they're just not quite out yet.
Excellent. Well, thank you for providing all of your insights. Happy Black History Month. And for more resources from MacMA, follow us on social media, and we will see you next month.